So the stock market is crashing. The social fabric is fraying. Gas prices are setting records, and so is inflation. But Joe Biden has a plan. He's going to ride his bike on vacation in Delaware, and he did that over the weekend. The problem is, for Joe Biden, not as easy as it once was. This happened.
Dr. Biden, how was your anniversary?
So to be clear, we're not attacking Joe Biden for falling off his bike at a dead standstill. He's at the age where that can happen. He shouldn't be riding bikes. He also shouldn't be president. The problem is that the people around Joe Biden, his chief of staff, Ron Klain, Susan Rice, to name two among many, are empowered by having this husk in the White House. So they lied about Joe Biden's physical and mental state for years. And the media have helped them. Here's the eunuch over at CNN bragging about Joe Biden's bike riding abilities, of all things.
You hardly hear about COVID at all. They have shifted to big-time Biden bashing instead. You know what this is? This is negative partisanship in action. What the heck is going on these programs? Look at what Fox News saw on Saturday at Rehoboth Beach, Delaware. This is Joe Biden out there on a vigorous bike ride. Not wearing a helmet, but definitely wearing a mask, by the way. Fox's narrative and talk radio's narrative for months has been that Joe Biden is falling apart. You just heard Ben Shapiro say it, falling apart. And there he is riding a bike, out for a bike ride.
He had a mask on a bicycle. So if that's not prima facie evidence of dementia, what is it exactly? We're not a doctor. Marc Siegel is a doctor, though. He's our doctor, and he has watched the tape from the weekend closely and was informed by it. Dr. Siegel, thanks for joining us tonight. What do you haven't treated him personally, but you saw the video. What do you make of that?
Well, Tucker, one thing you don't know about me is that I'm a cyclist, and I've been a cyclist all my life, and I analyzed that. First of all, of course, he needs a helmet. That'd be number one, and that I wonder why not. And the second thing is that maybe he should stick to his Peloton because that is a little safer than what you just saw. And I have to tell you, the kind of pedal that he's wearing with that cage, I wore that exact pedal riding across the United States twice when I was 20 years old. And you know how many times I fell because of the pedal? 0. Now, he's 79 years old, but we heard from his physical last year, has everyone forgotten this? That he had a sudden change in gait, rigid gait, stiff gait, and we didn't know where that came from. And they said neurologists examined him, but we didn't get a report, and we didn't hear about any MRI. And, you know, I don't know. It looked very awkward to me as a cyclist, the way that he fell out of that pedal. And I'm not used to seeing that. And I feel that it bears examination. I don't know him. I didn't examine him. But, you know, we have a right to know in terms of fitness. Now, let me tell you something. There's a study in the Frontiers in Human Neuroscience that came out in 2017 that said that cycling is the exact right exercise to use if you have Parkinson's, which I don't know if he has, problems with gait or problems with thinking, executive function. We're talking about the chief executive here, Tucker, the chief executive needing bicycling for executive function. I think the public has a right to know. I think he needs to wear a helmet, return to his Peloton, and we need to know what's going on with his gait and what's going on upstairs. Tucker?
Of course we do. Of course we do. We have an absolute right to know the results of his medical exam. And it's amazing that we don't. And thank you for reminding us of that. Dr. Siegel, thanks.
Thanks, Tucker.